Discolored, broken, or even missing teeth can take away your confidence, leaving you without the perfect smile. Veneers can correct all that, though. Joining us with the top 10 advantages to porcelain veneers, welcome family and cosmetic dentist Dr. Terri Alani, the Texas Tooth Lady. Hey! Just like we talked about technology with hearing aids and everything else, technology has changed also with veneers, starting with, number one, veneers can be contact lens thin, so not those bulky things anymore.
No, they're not because of technology. Technology now allows us with the new materials, they're very thin, Emax veneers, for instance. So basically, we don't really even have to take very much tooth structure down at all. Some teeth may need more adjustments than others, but we really don't even numb the patient up, and you don't really need temporaries anymore.
That's fantastic.
They're very thin.
Yeah, cuts down on time and they look natural.
Yes.
One of the other things that you advise people to do if they're wanting to get veneers is don't shop for price. Price doesn't always mean you know what you're going to get.
I always tell my patients, don't shop for parachutes. Don't do discounts for parachutes, heart surgery. And I know dentistry is not life and death, but you do get what you pay for.
Right.
And it's not always about price. You want to find a dentist that you know has done a lot of cosmetic dentistry, and also the lab is incredibly important.
You want to get something that's the best. And I'm going to tell you, I know somebody who did shop for price. Guess what happened? They paid for it, had to take them all off and go back and get the best thing.
Yeah, we
because
see
it just
a lot
didn't work.
Exactly. We get a lot of second opinions, and we encourage that. We see a lot of patients that have had them done by maybe some discount places, or the dentist really wasn't experienced, so it really does make a difference.
Yeah, they end up paying more to have it fixed. All right, number three, veneers do not stain nor change color, which is a great advantage.
They do not stain, but here's the thing. If you're getting ready to have veneers, and not always do you have to do like 8 or whatever, you might want to whiten your opposing arch first to make sure you get the color match.
Yeah.
Because over time, veneers don't stain, nor do they change color.
So your natural teeth have to keep up.
Exactly.
Okay. You can just do one, which again, a lot of people think they have to get 4 or 5 or the front, but you can just do one.
One is difficult, but if you've got a great lab, we do one all the time, and they can look fantastic. So you don't always have to do 8 or 10. What we recommend is either 2, 4, or 8. Usually, we don't like to do just 6, because your eye teeth are the most prominent teeth in your mouth. And if you look at a patient, that's all you'll see if you just do 6. So we like to go further back.
Yeah, yeah. All right, and if you just do that one, let's say you chipped a tooth or just one that's misshapen.
Match it. We can match it perfectly.
Okay. The great thing about veneers also is that gums can tolerate the veneers.
Exactly. You know, you hear patients go, oh, I don't want to have that black line.
Yeah.
You've heard that, right?
Yeah.
Okay, so we have a metal-free office. Basically, that's sort of old school where you had metal in the mouth. Porcelain veneers tolerate the gums beautifully. They're all porcelain, and so you really don't get very much inflammation or any inflammation at all whatsoever.
Yeah, and you touched on the fact that the time it takes to do this today has been cut down, usually done in just 2 visits?
We do it in 2 visits. The patient comes in, of course, after we assess them, do the x-rays and all of that. Then it's really a short appointment because we don't do that much preparation like we used to do. And then they come back, usually it's about 2 weeks, because you remember the lab has other cases also. So it's 2 weeks, and we try them in, and if you don't like them, they're not placed in your mouth at that point. Usually we schedule a lab appointment. Our lab, we're lucky, is right down the street. So if we need any tweaking, we just send the patient to the lab.
Yeah. A question patients might have is, what do the veneers do to our existing teeth? And you say in this case they can actually strengthen the teeth?
They really can, because they're adding, remember, you're adding an external layer to the tooth, especially if it's been chipped or cracked. So it actually will help strengthen the tooth, and it'll help reduce sensitivity.
Yeah.
So it does have some health benefits also.
And aesthetically, we know that the teeth look better, but aesthetically they can also make our whole face look better.
You know what? If you want to look a little bit more youthful, you can forget the knife. Go and have veneers done and have them added to your back teeth also, because it will help build them out, make your cheeks look fuller, and you look more youthful.
So not the injections, instead just get your...
Exactly.
Okay. Of course, you want to protect your investment, and using a night guard is important.
We We definitely recommend a night guard for every veneer case. It's going to protect your investment. Now remember, your teeth, they're not designed, especially veneers, to really bite into really hard things. So you really want to protect, especially at night. A lot of people are not aware they may be grinding their teeth, and it'll help protect your investment for years to come. So a night guard is very essential.
Okay, and then they last you for years to come.
Yes, they do. You know, now, there's life expectancy with every restoration, okay? Yeah. But these last, I know the first case I did was like 25 years ago, and it's still intact in the patient's mouth. But if you're smoking, if you're opening beer bottles with your teeth, they're not going to last as long, Deborah, but they do last a really long time.
Yeah, and you can repair things, so
exactly.
It's good.
And make sure you see your dentist twice a year to make sure that you have your gums and everything's healthy.
Yeah. All right, Dr. Alani, thank you very much. As you mentioned earlier, you can also pinpoint other diseases that people might be dealing with, type 2 diabetes, high blood pressure, the whole bit.
Exactly.
So you can be like where we can kind of go to get our whole physical just about.
Yes.
But Dr. Alani has a special offer for Great Day viewers. Come in for veneers during the month of June and save $4,000.